Good evening, Dr. Hernandez. A patient is going to be coming in today by the name of C.J. Hamilton, born February 28, 2016, here, of course, at the Houston Memorial Herman Southwest Hospital. He's coming in because he was having some digestive issues that we were trying to diagnose. He said that his symptoms were sore throat, burning, pressure, pain in chest, vomiting feeling, and his abdominal muscles were contracting, which of course that's an issue. He said he was also having trouble sleeping at night because whenever he would go to bed, he would feel something coming up in his throat. So I used the process of elimination and figured out that it was gastrointestinal reflux disease, GERD, as I'm sure you know. Um, these common systems, of course, are things that we can easily take care of. I've already taken his temperature, pulse, blood pressure, temperature being 89.2 degrees, pulse 79, blood pressure 130/77. His height is 5'10", and his weight is 165. He seems well. You can't really tell that anything is wrong with him, and his heart rate sounds great. It's at an 18 and sounds normal. His lungs are good, lub dub as usual. His abdominals are in good condition, and his muscles are in good condition. So his physical tests, he passed everything. It's all internal. From the clinical assessment, of course, I told you that it was a process of elimination, and I've decided that in order to help with this, to make sure that it actually is to do a esophageal manometry, and that's what you'll be doing. I have a family emergency, so I have to leave, sadly. But this exam will help truly diagnose a patient with what he's going through. Uh, with the esophageal manometry, it'll be very easy to diagnose a patient with what he has. Make sure that you use the numbing agent around the nose in order to make sure that when inserting the tube, that'll go through his nose, down his esophagus, and into his stomach. He will not feel any type of pain. Make sure to remind him that everything's going to be okay and it's not going to obstruct his breathing pathways. So he will be awake for the whole procedure. We'll just give him the numbing agent. If you'd like to, you can also use the numbing agent for the back of the throat to make sure that he doesn't have any discomfort during the procedure. When doing this, you could also make sure, if you feel that as the sensors of the machine are sensing that it is the GERD, if you want to make sure, you can have him drink a cup of water. That way, as the muscles in the esophagus contract, then the sensors will even get a better reading as to what exactly is going wrong, which I do believe is going to be the GERD. His treatment that I have prescribed for him is going to be, he has various ones that he can choose from, or that if you believe will be the best for him. He can either take histamine H2 blockers like Pepcid, Zantac. He can use protein pump inhibitors like Protonox, Nexium, or Prevacid. He can have antacids like Malox, Rolaids, or Tums. Make sure he doesn't eat too many citrus fruits and juices. No tomato products or spicy foods, because that can mess with the esophageal inner lining. Decreases portion sizes of food, and to eat about 2 to 3 hours before he goes to sleep. That way, when he's sleeping and the food is being digested, going down along with gravity, it doesn't mess up with him laying horizontal. Also, it is suggested for him to sleep with a block behind his under his pillow, so that he sits. It's going to be like a wedge, so that he sits at least like 6 inches above, being 180 degrees. That way, gravity will help any movement of the food going down his esophagus, and he won't have to be waking up in the middle of the night in order to, if he has any feelings. So those are my recommendations. His sheet is right over there. I have to go to my family emergency, but I will check in about an hour or two to make sure everything's going all right. All right, thank you.